Hello and welcome to the What Caregivers Need to Know video show by eCareDiary.com. I'm Susan Baida, your host and co-founder of eCare Diary, and today we bring you a very important topic for seniors, and if you're caring for a loved one who is aging and dealing with Medicare. We are talking about preparing for Medicare premium changes in 2016. I think many of us find Medicare a little complicated, so we're very happy to have Tony Noble explain to us what those changes are. And before we get to the questions, I just want to tell you a little bit about Tony. Tony is the president of A.E. Noble and Associates, Incorporated, specializing in financial planning, life and health insurance, and Medicare. Sounds like this is going to be very educational for me too.
Yes.
He's also an investment advisor representative with FSC Securities Corporation, which is a member of the advisor group. And you can find out more about Tony and his services at aenobleassociates.com. I will share your number as well. It's 412-798 3205 if you're here in Pittsburgh, and if you're outside of Pittsburgh, he also helps people who live out of state. And his toll-free number is 1-866-755-3205. Tony, welcome, and thank you very much for spending some time with us today.
I'm happy to be here. It's a great opportunity, I think, to educate some people today.
Yes. We have a lot of questions for you about Medicare premiums in 2016. So what specifically are these changes?
Well, premiums increased this year from where they have been the last couple of years. Social Security premiums are tied in directly to Medicare premiums, are tied in directly to cost of living adjustments under Social Security.
Right.
So the premium jumped from $104.90 per month to $121.80 per month for a lot of Medicare beneficiaries. This affects people who are new to Medicare this year, and it affects people who are not held harmless from the increase.
Okay.
And the people that are held harmless are folks in the lower income bracket, because premiums are tiered to your income.
Right.
There's a 2-year look back on your adjusted gross income, and if you are above $85,000 single or $170,000 joint,
we're talking income, gross income, yeah.
Adjusted gross income, then your premiums will go up this
But
year.
if they're below that, they remain at
the $104.90 as long as you were enrolled in Medicare prior to this year. If you're turning 65 this year, you're going to pay the higher premium.
Okay. So how do these impact seniors, and what should they be prepared for?
Well, obviously, higher costs to Medicare affects their budget,
right,
for everything else that they need to do. So they need to be aware of what that is so they can plan, so that they can choose the right supplemental insurance plans to go with their original Medicare to keep their costs in line.
Absolutely.
And it outlines why, for any younger listeners here today who still have a lot of time to save for retirement, why you want to do that so that you can handle your Medicare. And it also outlines why you should be concerned about maximizing what your Social Security might be later on in life as well.
Yeah. Let's talk about the kind of help that's available to certain seniors in paying for these premiums and deductibles and co-payments, because we know that can be pricey for many of our seniors.
Yes. Fortunately, there are several programs for seniors with limited income and resources to help them out with their Medicare Part B premiums and also their prescription drugs. There are 4 levels of Medicare savings programs. There's all kinds of crazy letters for them, like QMB and so on.
My goodness, acronyms.
Acronyms, which I don't want to get into. But basically, to find out if you qualify for those programs, you can contact your state Medicaid office,
Okay.
and they'll help you through the process. And if you can get into one of those programs, your Part B premiums may be covered in full or subsidized in part.
Right.
And also, it could help you with any deductibles or coinsurance that you might be responsible for on your Medicare plans.
So that help really is more for Medicaid
No,
recipients, or
not necessarily. Medicaid is the lowest for people with limited resources. You could have resources like a nice home and even some savings, but if your income falls within certain limits in retirement, you may be able to get on some of these Medicare savings programs.
Oh, that's great.
For
That's
your
good to
medical
hear.
stuff. You don't necessarily have to go on to Medicaid, which is a whole nother program.
Yeah.
Some Medicare beneficiaries qualify before age 65 because they're on disability, and so they would qualify for SSI benefits, which also can be used to offset some of the costs for Medicare.
SSI being
Social Security income
okay.
for disability. And then also there is extra help, it's called, also known as low-income subsidies, which if you qualify for the Medicare savings programs, you'll also qualify for the low-income subsidy to
Yeah.
help offset prescription costs.
Where can people go to learn if they qualify? Where is all this information available?
It is on Medicare.gov, and if you just search in there, you'll find it. And also, if you Google it, it'll come up.
Okay. Very good.
Finally, I just would like to add
Yes.
PACE. There's a program called PACE, and this is a program that's
PACE.
Yep. It's paid for by our state lottery, and folks age 65 and over may qualify for that based on income, and it'll greatly reduce their prescription costs.
And that is for those of you living in Pennsylvania.
That is correct.
Yes. Well, thank you for sharing that. Tell us, what is the difference between a Medicare supplement, a Medigap? Oh my goodness, I need a sort of a dictionary for all this terminology. Medicare supplement policy and a Medicare Advantage plan.
Well, I would say there's too much terminology in Medicare which confuses people. But the main thing to know is that a Medicare supplemental policy, also known as Medigap, is not the same thing as a Medicare Advantage plan. And here in Pittsburgh, when people hear UPMC or Highmark, that's often a Medicare Advantage plan. So a Medicare supplemental policy is different because it is a private insurance policy not to do with the federal government in any way that supplements original Medicare, meaning it covers the gaps, the things that
Are not
Medicare
covered.
does not cover. So that's what a Medigap policy for. It's a separate policy. A Medicare Advantage plan is a plan that's offered by a private insurance company, but the federal government subcontracts with that insurance company to take over paying the claims under original Medicare, under Part A and B, and also in some cases Part D, so all your benefits are now handled under one thing rather than two separate things.
Great.
There are pros and cons to both. The big benefit to a Medigap policy is that you do not have networks to adhere to, whereas when you go into a Medicare Advantage plan, they are often set up as HMOs, which is a health maintenance organization, or PPOs, which is a preferred provider organization, which is more terminology.
Yeah.
But basically what it means is there's going to be a set network that you have to stay within.
Certain
Otherwise,
service providers that
your
you have to
costs could
use.
go up. And
Yeah.
then also on a Medigap policy, typically you don't have a lot of out-of-pocket expenses above your premium. With a Medicare Advantage plan, the trade-off may be a lower premium in many instances, but then you're responsible for co-pays and sometimes
Right.
deductibles depending on what you're doing.
And this varies depending on state or where
It
you're
varies.
living in the country and what kind of plans there
It
are.
varies widely all around the country. I will say with Medicare that I am focused in Pennsylvania and helping pick plans for that. but it varies by county. The plans that are available here in Allegheny County are not the same plans that are available to people in the Philadelphia area or the Scranton-Wilkes-Barre area. There's different companies that dominate the markets.
Well, there you go. So, well, thank you very much for helping to clarify that a little bit. Medigap policies and Medicare Advantage plans. Thank you.
Right.
Okay, so let's talk about long-term care, because many of our caregiving audience are caring for aging loved ones, and some of them are needing long-term care. So is long-term care covered by Medicare?
No, I'm sure a lot of your folks have found this out already, but long-term care is not covered by Medicare at all. However, there is 100 days of skilled nursing covered under Medicare.
Yeah.
If you have just original Medicare, you'd be responsible for a copay of $161 a day for that skilled nursing from day 21 to 100 and nothing before that.
Just give an example of, if you don't mind giving an example of skilled nursing. When would an aging parent or spouse need skilled nursing as an example?
Well, I had a client who had a mini stroke and lost some of his speech abilities. And he was able to go into the facility for less than 100 days and actually get well enough that he could go home and still communicate. So that's an example. Or you could fall and break your leg and not be able to take care of yourself, and you could go into a facility for some rehab or something like that.
So it's 100 days of skilled nursing for that particular instance that it's needed, or is it for it's lifetime?
It's lifetime.
Yeah.
After that, you're on your own. So either you have to spend down your assets, and that could be devastating. If you do spend down all your assets, there is Medicaid, which is a government program that does address long-term care.
Yes. So let's talk a little bit about long-term care and planning for the future, and I think that's something that you do when you help families in terms of financial planning.
Yes, it is. When I'm meeting with a client to discuss their financial plan and their goals for the future, it's usually a topic that I bring up. Yeah. Because if they are putting in all this work to save money in their IRAs and their 401ks and other investments, and maybe they want to leave something to their heirs. Right. Long-term care is something that could come in and easily wipe all that out very quickly. Yes. I will say,
I'm sure many of us have seen that happen.
Yeah. Right. So planning for the long-term care portion needs to be thought about a lot earlier. By the time you're, into your 60s and 70s, it's kind of expensive to deal with the issue. Yeah. So, mid-40s, 50s is a good time to bring that issue up with people.
Great. Is there information on your website about that?
Yes, there is. There's a long-term care section of our website. When you go to the website, under the About Us, you'll have a drop-down menu, and there'll be different topics.
Great. Let me share that again. So that is www.aenobleassociates.com, and I'll share your toll-free number again. It's 1-866-755-3205. Tony, thank you so much for spending time with us and educating us a little bit about Medicare and planning for the future.
Absolutely. Thank you very much.
Okay, take care. And thank you to our audience for joining us. Until next time, take care.